even if that provider's excellent, if you don't vibe and connect with them, there are a lot of good providers out there. Make sure they're going to fit you and what you're wanting, and they have the same vision, right, that you do.
Yeah.
And the same aesthetic eye. So, they're not going to make you look like something you don't want, right? So I think that's really important.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk, where we feature the top medical practitioners in health and beauty, both inside and out. I have Dr. Michele Finley, who is a proven leader in creating and administering specialty health and beauty treatments for patients. She earned her Doctor of Medicine from Indiana University School of Medicine in 1991 after graduating with distinction from Notre Dame. After an internal medicine residency at St. Vincent Hospital, a subsidiary of Ascension Health, she became a staff physician for St. Vincent for 8 years. As her tenure grew, Dr. Finley became aware of the growing need for medical services beyond the scope of the structured government and insurance-controlled system, along with its obstacles and frustrations. So for the past 21 years, Dr. Finley has been a trailblazer in introducing treatments specifically targeted to wellness and well-being. So her practice now began as a cosmetic practice, followed by fitness, weight management, and hormone balance, to name a few. So Dr. Finley, welcome and glad to have you here. Yeah, so let's dive right into it. How did you first get interested in aesthetics?
Kind of in your intro, you got into that a little bit. I was really frustrated. I did ER medicine, then internal medicine after that. And I was really frustrated with how our time was being limited with patients, even 22, 23 years ago, that I could see what was coming in medicine and the control we had as physicians was eroding. I didn't like that either. And constantly I was having my patients, especially a lot of the women in my practice, in their midlife, and they were exhausted, and they were taking care of everybody but themselves, and they were depressed, and they were anxious, and kind of the same constellation of symptoms was happening. And I thought, and I did a lot of work actually in energy training and craniosacral therapy in my earlier years, and I brought that into my practice a little bit. I don't still really do that, but it still frames kind of my mindset of how I approach patients, with a mind-body-spirit connection, which is how I've always done. And I said to myself, gosh, there's got to be something better than this. And I went to a meeting about lasers, and at the time, there were only a few lasers that were on the market. IPL was relatively new. Fillers, the HA fillers had just come out. I mean, literally just came out, and toxins. And I thought, I'm not sure how I can make this work, but I know that if I make someone feel better about how they look, and when they look in the mirror and how they feel about themselves, that's going to spill over into other aspects of their life. That's going to give them more confidence when they're out in the public, working with people at their job, whatever they're doing, and they're going to feel better about themselves, and that will radiate out in their spirit and ultimately help them be healthier, because, that really is connected. Our physical health is really connected to our emotional and mental health. So you really can't separate them. So that's kind of how I spawned the idea. And I also, 30 years ago, I was doing work when the American Academy for Anti-Aging Medicine, which is called A4M, was in its early days, its infancy. And I was going to those meetings, and I was looking at how do we optimize hormones. And I was optimizing hormones in my practice 23, 24 years ago, and treating subclinical hypothyroid when people didn't have any energy and their numbers looked normal, but they weren't really normal for them. They still was symptomatic. So when I first started my practice, I started it with the vision of doing bioidentical hormone therapy and longevity medicine alongside aesthetics to really help people reach their full potential and live a long, healthy life. Not just a long life, but a long, healthy life. That's a big distinction, right? Mm-hmm. So when I started, actually the Midwest is kind of a tough place because it's a little behind from the coast, honestly. If I would have started that practice on either coast, I would have been busy doing all that work right away, I'm confident. And I really wasn't here. People couldn't get it. Coupled with the fact that was in 2003, and the 2002 WHI study came out, which was telling everybody that hormones were going to give you breast cancer, which was later walked back by one of the lead investigators in 2017. And that was synthetic hormones, not bioidenticals. So there was a lot of misinformation out there, and it just wasn't the right timing for that to launch here in my area of the country. So I kind of let that fall away for a while and focused on aesthetics, and brought in, one cutting edge thing after another for aesthetics. And that was challenging too, because again, we're in the middle part of the country. People aren't, usually they're not following things like they are on the coast. They're just not the trends aren't as obvious here. And we didn't have as much social media presence back then. The internet was, relatively new, honestly, so it wasn't as easy to get the word out, but I did. And, slowly, my practice grew and grew. And then as we went through later years, I added in M-Sculpt and muscle rejuvenation, muscle building. And I always had done liposuction in the office and body sculpting. So I added that as another avenue. And I've now recently re-emerged with hormone replacement therapy, and we'll be adding peptide therapy and other optimization therapies for longevity as the year unfolds here. So I'm excited to go back to my original vision and get that all going. I've actually been begged by my patients for at least 5 years, Dr. Finley, would you please help me with my hormones? I'm like, well, of course I can do that. I'm an internist, but there's only one of me, at my practice. And I am unusual because I really do the treatments myself primarily. When you come into my practice, you will most likely, for any injections or any heavy lasers, you're going to see me. I do have an esthetician who does some of my lighter lasers and does some other work in the office, but you're going to see me a lot. I'm a very hands-on physician in my office.
Mm-hmm. Now, you've talked about several treatments, kind of the progression that they've gone through over the years. More recently, what would you say is the most popular treatments that your patients are coming to see you for? And also, why do you think that they're so popular?
Yeah, it's interesting. And I think it's an evolution. I've really watched I got in this practice in its really early days of aesthetic medicine. I mean, really early days. And, fillers were reluctant. What I tried to get people, and I think they're finally grabbing onto, is they understand facial balancing and volume replacement when I talk to them about that. And thread lifts are really starting to come of age slowly here. They're very popular on the coast, I know. And I brought thread lifts in. Actually, the very first type of thread lifts which weren't reabsorbable way back. Those didn't last. I didn't do them very long either. But I've done thread lifts ever since they've been available, and only in the last couple of years have been some really last 5 years, but I've waited to put them back in my practice. But there's some really strong, great lifting threads that are out there by some Korean companies that I use in the office that really yield the results I want. Because one thing is, if it's not giving me a great result, I'm not going to stick with it, right? So I'm not going to charge patients for something that doesn't really give them what they want. And the threads now are really making an impact. And I think that, you can do a lot with just replacing volume and then just repositioning tissue. Lasers are always still good, that's great, but I think that we're seeing a new emergence of a little less of the gel fillers, more of the biostimulating fillers, which replace your own volume naturally with either through growing collagen or your own fat back, and some lifting with those threads. And a move away, not that surgery is ever going to go away, but I think more people want to either delay surgery or not have it at all if they can.
Yeah. Okay, now I want to talk a little bit more about what differentiates your practice. You mentioned that one thing is that you're the actual provider, you're the one actually giving the treatment to your patients, and that you're introducing a lot of these new concepts, or even ones that you started off with, now you're bringing it back. But what would you say is some other ways that you really differentiate your practice from others in the industry?
Yeah, it's, I think all of us are similar in some ways, right? We always, as physicians, I think we're always taught to put patients first, and I definitely do that in my office. And I'm about outcomes, right? I'm about getting a good outcome for the patient. I don't think that's that unusual. I think what is different, I'm more of a boutique style practice. So when you come in my doors, you're going to have a greeting from someone that knows you. It's a smaller practice. It's not super, super busy. I mean, it's busy, but it's not like your number, you're going to come in, you're going to be known who you are. One of the reasons I started this practice was that I could continue to have relationships with patients and continue to help them with whatever needs they have beyond aesthetics. I mean, I do a lot of soft counseling in my office, I would say, when I'm working with patients. So that differentiates me from, a practice that is super high volume and people just running out of there really fast. So I think that makes a big difference. Again, doctor delivered services make a big difference, but just the attitude. I mean, I'm always just worried about doing what's best for the patient. I think most physicians would tell you that, though,
Mm-hmm.
I'm never worried about what the bottom line is. I mean, I am a business, I have to keep my doors open, but for me, it's about getting that outcome. And the good thing about I'm now, after so many years in practice, is I've developed so many different skills, and I have so many different technologies in my office that I can really customize a treatment plan for someone and mix and match so many different things to really get them to their goals, which that makes my practice unique. Because if you haven't been in practice long enough and you don't have the skill sets, or you don't have different types of technology that you can blend together, you can't really get there. People, when they age, need layers of treatments, not just usually one. When you're in your 20s or 30s, yeah, you can do toxin, you can do a little filler here and there, and you look great. When you get older and you're more mature, 40s, 50s and beyond, you have to start layering things. You have to get some volumizing in there. You have to get some tightening, maybe some lifting. I have M-face in my office too to help the muscles. I always try to explain to people, your face has 5 layers and every single layer ages. So you really have to try to find something that addresses the aging in all those different layers. And I can do that at this point, which is really great.
Yeah. Now, you mentioned that it's really the personalized touch that you and your practice bring, and I'm sure education is a big part of that. So could you talk a little bit about how you approach educating your patients on the treatments you offer and also the benefits of it?
Oh, that's a great question. Education is the foundation, really, because when people come in, they understand that maybe there's something they don't like about how they look, or maybe a particular line or wrinkle that's bothering them, but lots of times they don't really understand what it is that they see that is making them look older or tired or just not themselves, So that's really where I start, is trying to gently educate people on how, like we talked about, the layers of the face and how all those layers age and what that represents on their face or anyone's face as we age. And then look at them and say, this is really where you're aging. Some people, they're really lucky and they don't lose a lot of volume in their face and they have more pigment problems we have to address, right? Other people are very thin and they lose a lot of volume in their face. They get very gaunt looking, and we need to address that volume first off. So I think it's about just teaching them about the aging process, understanding on their face what's causing that aging process for them, and then being able to tell them these are the solutions and options that you have without overwhelming them,
Yeah. Okay. Now, I'm sure that you get a lot of misconceptions as well as far as treatment you provide. I'm sure people come in and they're like, oh, they think they need something, but in reality, it's not a good fit. So what would you say are some common misconceptions that you hear the most of about the treatments you provide?
Gosh, that's a really good question. Well, I think one of my biggest jobs is managing expectations in the office. So, I always strive to underpromise and overdeliver. That's my goal. And when someone comes into me, one of the first questions I ask them, if they're older and they have quite a bit of aging on their face or descent of their tissue, is my first question I ask them is, would you want a facelift? Because if they're willing to get a facelift and that's really what they need, then I'm going to say, okay, I'm going to send you to a really good surgeon because I'm not a surgeon, and I'm going to have you spend your money the right way. And then when you've done that, you can come back to me and we can help maintain your facelift. But I don't hesitate to send people to someone else if they need something I don't have. So first of all, I've got to try to get in their head and say, would you do something surgical, right? And if so, these are the things I see, and I think this is where you need to go. And then if people say to me, absolutely no, they don't want to do something surgical, okay, that's fine. Then you have to understand you cannot get a surgical result with non-surgical processes. So trying to explain to them exactly what they can get. Like, a lot of people think that, when they've got jowling here really bad, if I just put filler here, it's going to take care of that. It's not. If someone has a very aged neck and they want to pull that up, there's just nothing non-surgical that's going to do. That's a surgical problem. So I think it's just, trying to gently help them understand what's a surgical problem, what's not, what's possible. And then, without making them feel bad about themselves, because we don't want to do that, So I think a lot of times people just don't understand what things can do, They don't know that filler can fill in hollows, but it lifts the face a little bit, but it's not a facelift. They don't understand that, when you have a really saggy neck or a sloping neck, that's about the only thing to do for that is surgery, So it's just kind of finding that space where you can help them understand what is possible.
Got it. Now, when they do make the decision, they do want to move forward. At that point, then how do you balance providing them with a relaxing experience, but also ensuring their safety and well-being during the treatment?
Well, we have a lot of things to help you. I mean, first of all, if you're doing something like if you're doing liposuction in my office, you're going to have a driver. I'm going to give you some medication, as well as the tumescent lidocaine. So if you're doing liposuction, that's taken care of. But even if you're doing a more painful procedure, maybe a heavier laser, right? Or some people find that RF microneedling bothers them, or some people just have a low pain threshold. It's always an option to have medication in my office for pain, as long as you have a driver. So that's always on the table for people, and they know that. The other thing I have is I have nitrous. I have laughing gas, nitrous oxide in my office, and I utilize that a lot with a combination of topical, and sometimes I do injection blocks, nerve blocks for people if they need to. So I mix and match anesthesia to keep them comfortable, and just have a nice chatter with them too, to kind of distract them from what we're doing, and that really helps. But I will say that I added the, it's called Pronox is the brand name, but it's nitrous oxide laughing gas a few years ago, and that has been a really nice thing for many, many patients. It really helps take that little edge off, as well as takes their anxiety away, because I think lots of times, especially the first time you're doing a procedure on someone, they've never had it done, they're nervous, they don't know what to expect. So my biggest job is trying to calm their nerves, and that helps. It really does help with it.
Okay, got it. Now, I want to go in a different direction with this next question. When people think about medical treatments, medical procedures, they always think that there's a protocol, that there's a step-by-step process in place. But what role do you believe creativity plays in how you approach patient care?
Well, first of all, if you're in this business, you really need to have a good aesthetic eye. You need to understand, like we've talked about, how the face ages, right? That's first priority. And then you need to look at someone and see where their aging's occurred, and understand with your skills what you can change. So, if you just start out when you're newly a filler, you don't really understand that putting filler here changes this. You have to work with that a little bit. So there is a real creative process. It's almost like being a little bit of a sculptor, because the volume replacement piece of my business is huge. It's really, really big. And that is kind of a sculptor. You need to be able to see in 3D and understand when you make a change in tissue, what it's going to translate into in other areas of the face. Does that make sense?
Mm-hmm. Yeah.
So there is a definitely creative aspect to it, for sure.
Okay.
And everybody's face is slightly different,
Yeah. So I'm sure that throughout your experience, you've had some particularly challenging cases that you've had to deal with. Would you mind sharing maybe just one story of a really tough case that you had, and how you were able to get them a successful outcome in the end?
Well, I can think back to a case where, first of all, if someone's not happy, I'll pretty much do whatever it takes to make them happy. That's just the way I operate. So I got a new technology in the office a few years ago that until you really use a technology, you're not exactly sure what it will do for you, right? So you encourage people to use it. And in this case, I came to understand, after using this technology for a little while, that certain types of bone structures that people have in their face don't really respond well to that technology. So if you have kind of a weak jawline, you don't get the change that you want to see with that technology. So a patient went through that she was very unhappy. She said, I didn't see the change that you saw. It doesn't look like before and afters. And I agreed. She didn't see the change. I didn't see the change either. So I said, look, I said, let's go ahead and put your line is a little bit weak. Let's define it with some filler. Let's put some biostimulator in your cheek and lift that up a little bit, because you've got some hollowness there. And I basically did all that treatment at no charge, so that I was sure that she was happy with the result, and she was happy with the result. In fact, after getting the biostimulators and filler, she sent her friends in for that same treatment. So it worked out well in the end.
Yeah, it's a great story. Because everyone thinks, like, when it comes to medicine, it has to be done perfectly the first time around. But people's bodies respond different, like you mentioned. So it's a matter of how do you pivot and get them that good result in the end. Maybe the first option didn't work out well, but the second one could, like in this case.
Absolutely.
Yeah.
And I think one of my biggest challenges is, and it's hard for people, and I get that, because this stuff's all expensive, but when you get the best result for people, like I alluded to earlier, is when you layer treatments. It's usually not just one thing. And what I try to do in the office to help people with that is bundle, right? I bundle the several things together and give them a cost break on that if they take on doing like the whole project, right? If you want to do all 3 or 4 things with me, that will then give you, because 1 + 1 in my world doesn't always equal 2. It sometimes equals 2.5. So when you layer that stuff together, you get better benefit and more benefit. So I try to make it possible for people to do that, because it really does make a difference. And I guess I'll tell you one more story while I'm on this. So there was another gal who did she did a layering procedure, and the first thing we started with was an extremely heavy laser. And I've done this laser many times. I know what to expect. I know what to tell them what to expect. And for some reason, her skin was thinner, and I don't know if she let it get too dry. I'm not quite sure what happened, but she was red much longer. She was a little crustier much longer. She came into the office. I reassured her, and got her to keep more moisture on it. Took about twice the normal healing time for that laser. And I know she was worried. I mean, and I kept reassuring her. And then when she finally got through that, she came back to me and she said, "I'm so glad I did that laser. I will do that again. I get compliments on my skin every day." So sometimes it's just getting them through the process. And for some reason, she had literally double the healing process time that I would normally expect. And we got her there. And then she went on and did the next two things in her process, and she was beyond thrilled. So
that's a great story. Story. So now, Dr. Finley, where do you think the future of aesthetics is going?
It's interesting. I do think you're going to see more of what I'm doing, which is trying to blend aesthetics and wellness, right? And not just focus strictly on aesthetics. I think that's really where this business is going. That's what I tried to do in the beginning. It just didn't work for me. It's not always good to be ahead of your time, so to speak, right? If people aren't ready for what you're offering, it's just not going to work. But I believe you're going to see more of what I'm doing. You're going to see more combination of longevity treatment, peptide therapy, hormone balancing alongside of aesthetics being offered. And we're going to continue to develop more non-surgical things that give people results without having to go under the knife,
Yeah.
So.
And that's something I'm actually seeing with a lot of other practices across the country, is mixing in that wellness with the aesthetics. And how do you make yourself healthy so that it reflects in the aesthetics, and then the extra aesthetics just to accentuate what you already have.
Absolutely, because it's from inside out, right?
Exactly.
So, the same concept. So the better you take care of your health and your wellness, and the better your nutrition is, the better your skin's going to look, so it just all plays together. So I think we're going to see more and more of that blending. And I think people want it because, that's one of the reasons I left traditional medicine. I was frustrated with the lack of preventative care, right? It was always responding to illness rather than preventing illness from coming on, and like I said, my goal is to have people optimize their hormones, optimize their health. It's interesting because 100 years ago, people basically died when they were at menopause. Half the women were dead by 50 in 1930. So now we're living half of our lives after menopause without hormones, so I've known this for a long time, that we need to continue to help ourselves that way. We need to continue to, why wouldn't we want to have our bodies having that same hormonal bath that we have when we're in our 20s? There's no reason not to. Our tissues are all going to stay younger and do better if we do that. So we're getting more and more physicians that are finally jumping on this train, and I'm glad to see it, because I think it's really the way to keep people the healthiest and keep them off a lot of medications, right? Yeah. And living their life, not having their health span stop before their life ends. I want their health span to bump right to where they end their life, right? So they're living a very productive, fruitful, active life until something happens that it's the end of their time.
Yeah, kind of like you mentioned earlier, you want to help them live long lives, but also healthy lives throughout the entire period.
Absolutely. Yeah. So, and, continue to look good too, right? I mean, I joke in my practice, but it's really not a joke. I just had this discussion the other day with a patient, honestly. I said, probably Mother Teresa, Gandhi, the Dalai Lama, they're so spiritually evolved that they don't care about what they look like, right? If we all could be there, that would be fantastic. But I work towards spiritual evolution and have since I was in my 20s, but I'm not there. I don't think I'm going to get to that point. I still care what I look like. I think I'm always going to care what I look like. So, and like I said, it's like, for women, especially, they can relate to this. Having a good hair day versus having a bad hair day, it kind of changes your mood for the whole day, right? So I'm trying to give everybody a good skin, good hair day every day, right? So they wake up in a good mood, and it does affect their spirit, and it affects their well-being, which ultimately affects their health, right? So, I don't apologize for what I do. I applaud it. I'm glad and I have people come into me from, teenage years to 80s. I have several patients in their 80s that are still coming in and getting treatments in my office.
That's great.
Yeah.
So now I have one last question for you, but before I ask it, I want to point people to your website at www.michellefinleymd.com. Now, last question is, what do you think is the most important piece of advice you can give to someone who's thinking about getting some type of aesthetic procedure done, but isn't sure which provider to choose?
Wow, that's a good question. I always try to tell people to look for experienced providers because there's really no substitute for experience. Someone that's been in the business longer, has done the procedures longer, they've seen, and surgeons too. It's same thing. If I send someone to surgeon, I typically send them to older, more experienced surgeons. They've seen more of the complications just because they've done more things. The more things you do, you're going to have a complication here and there, and you need to know how to handle it, right? So you definitely want to have a good chunk of years underneath your belt for experience doing these procedures. And I personally think you need to have a degree and have, good training. Now, I will tell you, it's much easier to get training in this now than when I started out. When I started out, there were no formal training programs. I was lucky to be mentored by some excellent physicians in my early years. There is a lot of good training out there now for people to be able to get, but I think you need to at least have an advanced, in my opinion, nursing degree or medical degree, and they need to understand anatomy. That's really important. So, or have nurses or advanced practice nurses or PAs. I know some fantastic ones that are top notch, right? But they're really experienced and they've really done the work. They've done the work and knowing their anatomy, knowing how things work. They've been there, done that. So you just kind of got to look at their resume a little bit and make sure they really know what they're doing. And it's always nice if you have a physician on board that's there in the office too, that's, available for problems, complications,
Okay, got it. Well, there you have it. Dr. Finley sharing her expertise. So Dr. Finley, where can people contact you in your practice?
My practice is in Carmel, Indiana, which is a north suburb of Indianapolis. So you can contact me through my website, right, which you mentioned, and our phone number is on there, 317-571-9966. But we also have an Instagram site, a TikTok site, and Facebook. So you can DM me on Instagram too. We'll get back to you. So there's lots of ways to contact us. We have online booking on our website now, which is nice. And that's an easy way for people to book a consultation to come in and talk to me. And I always encourage people, I don't charge for consultations, Daniel. They're complimentary. Make an appointment, come in and chat with me. Make sure that we vibe together because you need to like your provider, right? Even if that provider's excellent, if you don't vibe and connect with them, there are a lot of good providers out there. Make sure they're going to fit you and what you're wanting, and they have the same vision, right, that you do. And the same aesthetic eye. So, they're not going to make you look like something you don't want, right? Mm-hmm. So I think that's really important. That's why I don't charge for consultations. I want people to feel comfortable and not, be afraid to come in and just chat and learn. And honestly, I do consultations for people that come into me for a problem and I'm not their answer. And I sit and talk with them. I talk to them about their diet, about their health. I send them to a surgeon or tell them what they need to do. And they're not doing anything in my office. They thank me for my time. And, maybe I see them again, maybe I don't, but that's my job. My job is to be in service of my patients, however that looks. So
well, that's awesome. Well, again, thank you for being on the show and sharing your message.
Thanks, Daniel. I truly appreciate it.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.